Hi and welcome to Pelvic Exercises. I'm Michelle Kenway. Today I'd like to talk to you about the very important issue of protecting your pelvic floor after prolapse surgery. Whether this be prolapse surgery for bladder repair, perhaps bowel repair surgery, or also to uterine prolapse. So the same principles apply in that you're looking to minimise the downward pressure on your pelvic floor and also to maximise the support of your pelvic floor so that this doesn't happen again in the future. Let's talk about some strategies you can use in the early days to minimise the amount of downward pressure on your pelvic floor. Perhaps the first thing and a key thing to do is to make sure that during your recovery in particular, you take time to rest, and that means resting lying down. Important that you're mobilising during as according to your gynaecologist's guidelines, but it's also important that you take time to rest, and this means lying yourself down, pillow underneath your knees to elevate that area and allow those tissues to have time during the course of the day to repair and recover without the weight of your abdominal contents dragging down. We know very clearly that the most pressure on your pelvic floor is in standing as opposed to sitting, as opposed to lying, that has the least amount of pressure on your pelvic floor. So take some time during the course of the day to get the pressure off your pelvic floor tissues after your repair and elevate your legs. Very important. The second thing, and it's a useful tip, is to use some large supportive knickers when you are mobilising and moving around. Large supportive underwear, firm abdominal support, not with a tight waistband that would cinch you in, but just some nice large firm knickers when you can tolerate them will often help to give you a little bit more support and control through your abdomen and through your pelvic floor in those early days when you're starting to mobilise and recover from your surgery. As things move along, it's vital, and again in the early days, that you avoid straining. So straining is one of the key things that can contribute to a recurrent prolapse, whether it be a uterine prolapse, a bladder prolapse, or bowel prolapse. And that means straining to use your bladder or your bowel. So it's something that you really need to avoid. If you need further information on avoiding straining with a bowel or bladder prolapse and using your bowel and bladder properly, please check out my website, pelvicexercises.com.au, and there's some training videos, free training videos there for you to look at to actually teach you how to use your bowel and bladder without straining. Remembering the key elements being keeping your stool soft, especially during the early recovery period, and not ever straining, never holding your breath and never pushing down through your pelvic floor as you empty your bowel and your bladder. Correct position and technique are vital with that, so please check my website for further details on that. Okay, so we've talked about so far taking the time to rest, wearing some large supportive knickers. We've also talked about not straining when you use your bowel or bladder. Also important that you don't or you try to support your pelvic floor when you cough or when you sneeze. So coughing and sneezing are more actions and activities that can also increase the downward force on your pelvic floor. That diaphragm descends forcefully with a cough and sneeze, and your upper abdominals pull in strongly, and all those things can increase the pressure down on your pelvic floor. And we obviously want to minimise that pressure after prolapse surgery. What can you do? Try and support in the early days. Use your hand underneath your perineum in that area between your vagina and your anus. You can support that whole area. You can choose to sit perhaps rather than stand, which would also then minimise the downward pressure on your cough. Try to avoid, and you probably need to speak to your doctor if you do have a bad chest infection with a lot of coughing, particularly after a prolapse repair. Now long term, other things that you might like to be mindful of are avoiding heavy lifting. During the early days, you'll know that to minimise your lifting after a prolapse repair, but this applies to long term as well. Any heavy lifting you do will be likely to load up your pelvic floor and increase the strain your pelvic floor tissues are under. So be very mindful about long term, dividing up how much shopping you carry, lifting smaller loads with your washing, not everything at once. So just taking the time to split up tasks and lifting lighter loads is very important too. Okay, moving along. When you return to exercise, safe exercise is vital following prolapse surgery. So this includes cardiovascular exercises, so you'll be looking to choose low impact cardiovascular exercises, avoiding your high impact exercises long term, such as jumping and running, which can increase the impact on your pelvic floor. Heavy weighted exercises will also increase that impact on your pelvic floor, and this is particularly relevant for you women who are doing exercises for bone density. So you need to be particularly careful and clever about how you strengthen your muscles and your bones following prolapse surgery. It doesn't mean you can't do strength exercises, you definitely can, and I detail this at length in Inside Out, my book on safe exercise for women with prolapse repair and living with prolapse issues, available from pelvicexercises.com.au. So important to minimise the high impact exercise, choose safe resistance training exercises, and also to avoid overloading your pelvic floor with intense core exercises. Don't forget that intense core exercises can be in any number of classes. Pilates classes can use intense core exercises, some yoga classes. These are intense upper abdominal exercises that will inadvertently or directly put pressure on your pelvic floor. If your pelvic floor is not strong enough to withstand the downward pressure of these exercises, it will descend and it'll put strain on your pelvic tissues. So very important that you exercise very safely following prolapse repair. Now, finally, we've talked about issues to minimise the amount of strain down your pelvic floor. We also want to talk about improving your support, so don't forget your pelvic floor exercises. When your gynaecologist gives you approval to start your pelvic floor exercises, these are vital after prolapse surgery. Pelvic floor exercises will increase the thickness of the tissues, of the pelvic floor tissues underneath. They'll increase the firmness of those tissues. They'll increase the support of that area. So this will help you to move around and do your everyday activities with much more security and comfort, knowing that you're not going to be putting so much pressure on that area, or you'll be actually able to withstand the amount of pressure that you put on that area by having a strong, well-functioning pelvic floor.